Hi, I'm Melissa Bantug in the Johns Hopkins Breast Cancer Survivorship Program. Today we're joined by Mary Eve Brown. She's a registered dietitian certified in oncology. Mary Eve, it's great to have you here.
Thanks for having me.
Can you tell me a little bit about how a breast cancer patient can maintain or achieve their optimal weight after breast cancer?
That's a great question. So maintaining an ideal body weight after treatment is vital, and there's lots of literature about that. So one important thing is to be physically active. 30 minutes per day is what's recommended. Then also look at your diet. That would be the second thing. High fiber, low fat, those are both important parts of a survivor's diet. Plenty fruits and vegetables, limited amount of meats, eat from the planet. Those are the tips that are going to help you maintain an ideal body weight.
And so are there any cancer prevention diets that you recommend or any hot topics that would be worth mentioning?
So if those things that I talked about are all prevention, and actually the root of a prevention diet is all diseases. So it's cardiac preventive, it's diabetes preventive, it's cancer preventive. So it's plenty of fruits and vegetables, and the key is variety of color. So when you look at your vegetables, you've got not just things that are green, but orange and red and purple and white. Fruits, not fruit juices, but actually eating the fruit, which has fiber in it. Whole grains, so you're eating unprocessed foods as it came out of the planet. Brown rice, quinoa, whole grain breads, whole wheat pasta. Fish is a great idea a couple of times a week. White meat poultry, low-fat beef, low-fat dairy. Olive oil is a good idea. Avocado is a good idea. Saturated fats are not a great idea.
And some examples of saturated fat. What would that
Butter is a good one. Chicken skin is another one. Anything that's trans fat, like margarine, those are all unhealthy fats.
You hear some patients that talk a little bit about making extreme changes to their diet. Do you recommend that patients become vegetarians or make any other extreme changes after cancer?
I think it's a personal choice. A vegetarian diet is a great option for many people. So if it works for you, I think that's a great idea. You want to make sure that you get the protein in. So depending on your degree of vegetarianism, you really should meet with a qualified nutritionist to find that balance for you. But I don't think extremes of anything are a really good idea. So it has to be a personal choice.
And what about the idea of organic food? Do you recommend that patients have a diet primarily with organic food, or do you think it's okay to pick things that maybe not organic?
So if you looked at evidence-based data, there's not really much you're going to find about the benefits of organic. Again, I think it's a personal choice. I do think that if you want to work it into your food dollar, I would make some wise choices with that. So look at things that you can't take out of. And what I mean by that is dairy. So can you do organic milk instead of regular milk? Organic yogurt, because those are not going to be susceptible to antibiotics or hormones and the pesticides. Poultry, beef, the same concept. With fruits and vegetables, things that have a thick skin on them, you really don't need to put your food dollar in organics with those, or that you don't eat the skin. So, you know, avocados and bananas and melons. Things that you do want to spend your food dollar in if you want to do organic would be things with thin skins. Grapes, peppers, apples, peaches, and then leafy greens, lettuce, spinach. Those would be a wiser choice for your organic food dollar.
What about soy? Do you recommend that breast cancer patients avoid or limit their soy intake?
So just recently, AICR, American Institute of Cancer Research, came out with a paper about soy and breast cancer survivors. Before we looked at the evidence-based, and it was 50-50, pretty much split. Half saying, yes, it's probably fine to do soy in estrogen-positive women. The other half saying, maybe not so. The new literature that just came out says that it's probably safe for all women to do it, 2 to 3 servings per day, and that's about 11 to 15 grams of soy.
What about a multivitamin for patients that may not be having a very diverse diet? Would you recommend that patients take a multivitamin?
I think you need to get your vitamins and your nutrients from food. There are properties in foods that we can't put into a pill, but I think a multivitamin is a good idea for most people.
What about other supplements? Do you recommend patients take other supplements?
I really think most people should get their vitamin D level checked. That'd be the big one that I would say, because the large population is vitamin D deficient, and we now are knowing that that's probably a risk for cancer and breast cancer in particular. So I think getting your vitamin D level checked by your primary care physician is a great idea, and you will need to take a supplement if you're vitamin D deficient. Calcium may be another one that women need to look at. It's difficult sometimes to get the 1,200 milligrams per day. So if you're not getting 2 to 3 servings of dairy a day, I think calcium would be a good idea. Again, talk to your physician about that. So vitamin D and calcium probably are the two that I would recommend in addition to a multivitamin.
What about alcohol consumption? Do you advise patients to avoid alcohol after breast cancer?
So the American Cancer Society's recommendation is 1 drink per day for women and 2 drinks per day for men.
Okay.
So if that's part of your lifestyle and it works for you and you're doing the safe amount recommended by the American Cancer Society, that's fine.
Are there any other tips that we need to know about going forward?
So I think you have to look at the whole person, but weight is one of the biggest factors that comes up over and over again in evidence-based, maintaining an ideal body weight. And sometimes after treatment, that can be difficult. So exercise and looking at the prevention diet can help that make that easier for you.
Great. Well, Mary, this was so helpful. Thank you very much for joining us.
Thanks for having me.
Thank you very much for joining us today.